Hello, this is Stacy Dillon. Welcome to my documentation presentation for Bryan and Stratton, MCCG 262. Welcome. The purpose of this presentation is to talk about the importance of documentation. We have 4 patient charts coded by an intern that have been audited. In these cases, we'll go over the correct codes and talk about whether the documentation was complete or whether more information could have been helpful. We'll also cover some aspects of the importance of documentation. So let's get started with the patient cases. So the first patient case we have is 410345. The first diagnosis is correct for the intern. The procedure code is also correct, although there is a required modifier for the case. F9 must be added to reflect the right hand 5th digit. Also, there's 2 external cause codes that are required to fully explain this case. The case says that the rope was wrapped around his hand, but really nothing more. Even though there's not much detail, the use of unspecified for both activity and place should be used. While the right hand with 5th digits are examples of good documentation in this case, is also a good case where documentation could be improved to clarify the activity and the place for more accurate coding. Okay, the next case is for patient 410481. And for this case, the intern had the diagnosis codes correct. The C4A39 refers to Merkel cell carcinoma. The history code Z87891 for nicotine dependence is almost always relevant in cancer cases. Because this is a surgical case, the history code for Z7982, long-term use of aspirin, is also needed because it may reflect or may affect the bleeding time. The procedure code for this case needs some review. 14301 is wrong because it specifies any area, where there's more specificity in 14041 that says it's for the cheek. 14041 also specifies 10 to 30 square centimeters, where the procedure is for 45. So in this case, 14302 needs to be added to cover the additional 15 square centimeters. It would actually cover up to 30 additional square centimeters. The documentation of aspirin, again, are good examples of proper documentation. Oftentimes those are missed. For patient case 410503, the intern completed this scenario accurately. This was a pretty straightforward case. Something to note on these cases is that if the documentation had stated that this was an infected pilonidal cyst, then abscess could or would be coded. This would affect both the procedure as well as the diagnosis codes for the scenario. And this is another reason that documentation is so important. A single word, infected, could have changed the entire coding for this patient chart. For patient case 410512, the intern struggled with this case. Now, I got most of those codes wrong. The first listed diagnosis is correct, residual foreign body and soft tissue. The correct procedure code is 10120RT. Incision and removal of foreign body, subcutaneous tissue, simple, right side. The intern's procedure code also refers to a foreign body, but it refers to a deep musculoskeletal level. So this here was just the skin, subcutaneous. This case had several external cause codes to identify what happened. Throughout the chart, it says the mother states the child had fallen through a glass table, and another time that she was doing a handstand on the couch and had tumbled down. So horseplay here is justified by the handstand. Tumbling down from the couch would justify the fall from couch. Contact with sharp glass stems from the falling through the table and the glass and that situation. All of this which happened at home and is coded as other place, an unspecified, non-institutional private residence as a place of occurrence. In other words, this happened at home. So throughout the patient cases, the scenarios, we talked about the documentation in those cases and how it either may have supported the case or if information was missing. Proper documentation overall is important for many reasons. It does help to ensure that billing and reimbursement is handled properly, remember that you can only bill for what is documented. So if it's not documented, you will not be reimbursed for it. It also helps provide a continuity of care, communicating the level as well as the quality of care to other providers and practices. Good documentation basically charts out the patient encounter. It tells a story. It provides an account of the patient's concerns as well as the physician's assessment of the situation to the patient. It also reflects the cause and effects of their conditions and diagnoses. And this would also be where we would want to make sure that we noted our medical necessity for our coding. The data that's gathered is not only used for the patient and for billing, but is also used for nationwide and worldwide data tracking and research for certain conditions, diseases, and cancers, etc. The bottom line is that proper documentation is essential for many areas for many reasons. Thanks for joining me for this presentation today.